On this edition of the Point and Click podcast, we're going to talk about electronic healthcare records and how your medical information is moving from paper to your computer and smartphone. That's next. Welcome to the show. I'm your host, Mark Yafchak. What are electronic healthcare records, and how are they changing the way we handle and manage our personal medical information? Now, a few statistics. According to the latest information, over 90% of office-based physicians in the U.S. are using some form of EHR system. The global market is expected to continue to grow due to increased adoption and technological advancements. Studies have shown that EHR adoption leads to improved patient safety, better coordination of care, increased efficiency, and reduced medical errors. There's a growing trend towards mobile integration of these systems, which allows healthcare providers to access and input data remotely. This facilitates better communication and care integration, especially in settings such as telemedicine. My guest is James Daly, a principal trainer at a large metropolitan health organization. Jim is a registered nurse with over 30 years of experience. He graduated summa cum laude from Villanova University's School of Nursing and completed his master's in healthcare informatics at the University of South Florida. He'll give us an overview of EHRs and how they are shaping the future of healthcare. Jim, welcome to the show. Tell us a little bit about your background and what you do.
Well, thank you, Mark. It's always nice to be here on your show. It's always nice to see you as well.
Thank you.
As you mentioned, my current role right now is referred to as a principal trainer for research for a large metropolitan health organization. But prior to that, my main role was as a registered nurse. Been a registered nurse for almost 30 years now, getting close to it. I've been a number of different roles in healthcare. I've worked in psychiatry. I've worked in the emergency room. I've worked med-surg. I've worked what's referred to as PM&R, which is physical medicine and rehabilitation. So did a little bit of everything. But after about 25 years, I'm like, you know what? I can't lift as much as I used to. And since electronic health records are so prolific these days, it's like, you know what? I kind of want to know more about them. So after, of course, I had my bachelor's in nursing that I got from Villanova. And then I decided to go back and get my master's. And I got a master's in health informatics from the University of South Florida. So.
Wow, you've done a lot. You've been doing a lot of different things. I know when you first started out in nursing, I'm not going to say how many years ago. You said 30, so 30 years ago. It was interesting because you were nursing at a hospital here in Syracuse. And it was interesting to hear stories about your adventures there. And I know it drove you to pursue other avenues within the medical industry, which is great. And it's good to do that. But that's kind of what brings us to this topic of healthcare records. I know people are always interested in knowing what kind of information exists out on the web on them. If you do a search on your name, you'd be amazed to see how much stuff is out there. But not to say that the health records you have are out there, but just to say that information is prolific on people. But that gets to our topic of the day today, which is electronic healthcare records. And what you're doing right now is intriguing to me because I've had exposure to it, having had a family member that was hospitalized, and learning how to access what people refer to as a portal to get health information. What we're going to try to define and help people understand today is the topic of electronic healthcare records. And maybe you could give people a little description or definition of what that is.
Well, sure. So electronic healthcare record, or an EHR, sometimes it's referred to by short, is simply an electronic version of your health information that is kept by either your physician or your hospital or wherever you receive care. It's been quite a long road. Certainly, again, you mentioned we go back a ways. We're old enough to remember when all this stuff was on paper. And so there's been a rather long progression from where, again, back in the 70s and even the 80s, where the understanding was these records belong to your physician, even though they were about you, to now the understanding now that these are your records that other people document on, but you have absolute rights to the information that's in it. So it's been a long time coming, but I'm glad we're where we are right now.
So, I mean, give us a little bit of an idea of what the advantages are of having an EHR. That's short, by the way, for electronic health record. What are the benefits?
Well, there's a number of benefits. So one certainly is the idea of portability. You get to have your records with you wherever you are. Again, going back into the days where this was all in a paper file or in a chart somewhere, you had to go wherever that physical document was if you wanted to see that information. Now it's electronic, so you can have it on a tablet, you can have it on a cell phone, you can access it on your computer. And so the portability access is a whole lot better. The other thing, and anybody who's old enough to remember, paper documentation, is you have to get past people's penmanship, or shall I say lack of penmanship. Again, if you're old enough, you remember the jokes about, doctor's handwriting being just this like little scribble along there, and it said whatever the doctor told you it said, right? Whereas now, again, it's going to be typed, it's going to be computer generated, it's going to be legible. So it's absolutely clear what is in your record, which is beneficial for you because, of course, as you're reading it, you can actually certainly look over your record to make sure, are there any mistakes that are in your record, all right? Even though it's electronic, it's still, all this inputting is still done by humans, and humans still make mistakes. And so it's much easier to find those if you can actually read them. Mm-hmm. Again, the other thing as well, too, is, again, because it's portable, again, you actually can bring that with you. So if you're going to a new physician or a new provider, again, most people can't remember everything they've ever had. I literally just had this situation with my physician for a physical, and they're like, do you remember the last time you had a tetanus shot? No, not really. I don't. But if I go to my records, I can go and tell you when it was. But yeah, so it's nice to have that stuff, and you literally just whip out your phone and go, okay, this was the last time I had a tetanus shot. Something just as simple as that, where you couldn't do that when it was on paper. So
now we have
definitely
the
a benefit
advantage
right
now. Let's talk about the disadvantage. I mean, what are the risks or troubles that you could run into with an EHR?
Well, again, one of the disadvantages, and it's probably one of the more obvious disadvantages, is, again, it's all electronic. So you need to have some sort of electronic device to access it. Again, if your physician makes a copy of your paper document and they hand it to you, well, then you have that with you. Doesn't require anything on your part, but to access electronic document, you need to have a cell phone or a tablet or a computer, or some sort of way to access the internet in order to get that information. So there's that. That does make it a little more challenging for folks who have limited means, or are not particularly computer savvy. That might be a little bit more of a challenge to them. It's also, you have the same issues you have with any kind of electronic media or entertainment. Anytime you're on the web, is you have the risk of people trying to hack into your system. And again, so for example, you're looking over your information. Let's say you're in Starbucks, all right? You're reconciling stuff in Starbucks. And what's to say there isn't somebody in Starbucks who's, over their not so secure Wi-Fi, trying to get information. Of course, these are your health records. So there's lots of very important things on there, like your social security number, for example, and that you do not want people getting access to. So again, there's precautions that you would have to take anyway on an electronic device. That, again, it's one thing if, people see what, you're doing on Facebook. It's a totally different thing if people have, very important information about you that they can, sell on the dark web and do all kinds of mischief with. So that's definitely one thing right there.
Now, are there any other forms of electronic health records that people would have any contact with in the medical world? Is there anything that they, in addition to those that we've talked about?
Yes. So, and this actually goes back to some of the advantages and disadvantages. Again, so when we're talking about electronic health records, we're talking about software companies. That's who makes these things, these different portals where this information is stored. And again, like any other software company, so you take, Microsoft and Apple, all right, is a good example. They're encouraged to make things that, so they stay on their network, all right? They're not encouraged to, make things easy so you can take your your Apple stuff and go over to Microsoft or vice versa, right? They want you on their stuff because, of course, they want to sell you their software. So one of the disadvantages also that comes with that is there's a number of different players that are out there. There's some that are more popular than others, and so you're more likely to run into them. But again, if you have a record on one service, and then you have a different record on a different platform, they will not speak to each other. And so you need to have two different apps on your phone to access them. The other thing, this is a little bit different than what people would traditionally see in the public sector software industry. So say, for example, we have two hospitals in the same city, and they're on the same platform for electronic health record. Again, this is your information. So the fact that it's the exact same software doesn't mean that those hospitals can talk to each other.
Oh.
They still need your permission to see your records at hospital B if you're at hospital A, and vice versa. So, just because they use the same software doesn't mean that they can, I can just talk to anybody who has this software. They can, as long as they have your permission first, and they need to get that. So that's a little bit of a difference there. The thing that the different states have these down and different localities have is something referred to as a health. It's an HIE. It's a health information exchange. There it is. Late in the day here. And this actually came through a federal regulation. It was called the High-Tech Act. It's back in 2009. And in order to get federal dollars, because of course, for hospitals to buy all this software and change things over and make things much easier for the consumer, this is a lot of money. This is more money than your hospitals had. Most hospitals would not be in business if they were not already getting federal subsidies, all right, Medicare, Medicaid, things like that, because healthcare is expensive. There's no way around it. It does cost a lot of money. So in order to do this extra change, which again, this is millions and millions of dollars to do these kinds of changes, they needed some financial assistance as well. So the High-Tech Act was part of that helped get that money. But in exchange for that, they had to send up these HIEs, these health information exchanges. And what they do, so they're similar in one respect to an electronic health record, which is your personal record. But what they do is they actually pull information from your visits, from medications that you have, prescriptions that you get, and things like that. And it's pulled into a database. Now, obviously, a database would not be very useful if there wasn't data in it. Right. And so by default, this information gets pulled in. You do have the right to fill out a form, whether it's in paper or electronic, depends on your locality, to say that you do not want your information pulled, but you have to do that. The default is we take your information. It won't be as robust as what's in your personal record, your healthcare, your EHR, but it's enough to give people a heads up as to what's going on. And that can be actually very useful in a number of ways. So again, say, for example, you are an elderly individual and you're on a number of medications that work really well, but you have a very hard time remembering what they are. In the health information exchange, when you show up at the emergency room, they can actually see that information and they can see, okay, well, you have prescriptions for these medications, so I know you take them. And based on what you are able to tell me, I have an idea why you take them. They're also useful, and sadly, this is also another good reason for them. Again, there are people who always try to take advantage of the situation in the system. So if you have somebody who is, the term being doctor shopping, all right, and they're going from emergency room to emergency room to try and get medications because they have an issue. They have some sort of a substance abuse issue. That can also be seen. So if they show up in an emergency room, they can actually look and say, hey, you just left an emergency room 5 hours ago for the exact same issue. So again, can prevent people getting medications they should not have. And in those cases, if possible, maybe getting social work involved, saying, what you actually need is you need substance abuse treatment. You don't need more medication. So,
well, that's good. I mean, when you think about the access that people have to that information, it does act as a checks and balances, really, for people that, like you just mentioned, that might have issues. And,
yeah.
the days of people walking up to a counter with a paper prescription that could have been forged or written, even in the day, early days, they weren't even what do they call it? Secure pieces of paper. Anybody could write on a piece of paper and say, "Here, this is what my doctor says I need."
Yeah.
And there was no accountability. But you're right. That's something that I didn't consider. Is that kind of leads me into my next question is about healthcare information exchanges. Is that kind of where these different entities would exchange that information and avoid this duplication?
So it depends on your locality. So there's actually a couple of different types of health information exchanges. The one that I'm most familiar with, the one that I work with on my day-to-day basis, certain information is automatically pulled and is pulled in, which is nice because this is the one thing that will talk across platforms. So again, you have information from hospital A and they use this platform, and then you have hospital B and they use a different platform. This will actually bridge the gap and be able to decipher information from both and put it onto one piece of information for your physician or whoever is treating you to see that. Social workers are another person who usually have access to this types of information. And then they can see that. Again, it won't be as robust as your personal information because not everything makes it across. But it's kind of more like a 30,000 foot view as opposed to the really granular look that would be your actual record.
Okay. I mean, we've looked at the past, the present, and it kind of occurred to me, where do you see the future of electronic health records going? Are we going to get to a point where, I mean, there's always the issue, people say, oh, well, they could just put a chip in you that has all the information and then just somebody waves a wand over it and they've got everything, or a key fob or a thumb drive. Do you think that that's the future, or do you think where do you think we're heading, I guess is the question?
Well, in the near term, one of the things that's definitely going to be changing over time is the type of information that you can actually get access to. So there's actually a fairly recent statute that came out from the federal government. They call it the 21st Century Cures Act. And the 21st Century Cures Act regulates the types of information that needs to be released into your personal healthcare record and how quickly it needs to be released. So prior to that, a great example of that would be lab results, right? So you go to your doctor and they get take some blood from you and send it off to the lab. And prior to the 21st Century Cures Act, it could be 3 days before that actually hits your electronic healthcare record. Now, your doctor knows about it long before, but they have 3 days to release that into your record. Now, that gets released into your record immediately. So literally, you're finding out at the exact same time as your physician. And again, I've had that experience as well with my recent physical, where, of course, my healthcare record's popping saying, hey, you have a new lab result. And I'm looking over my lab results. Of course, I'm, background is as a nurse, I'm looking over this going, this is perfectly fine. And then, 3 hours later, my doctor's calling me and saying, hey, Jim, your labs are perfectly fine. I'm like, I know. Yeah. I knew 3 hours before you told me.
Yeah.
But I mean, that's kind of nice. I mean, again, if you're concerned about a lab, again, you're going to find out as quickly as possible. The difference, the one exception to that currently would be the emergency room. So the emergency rooms can have them for 6 hours before it gets released to your records. I mean, if you think about it, though, if you're in the emergency room, you really do have better things to be doing than looking at your phone to wait for your labs to come in.
True.
Right. So, I mean, that kind of makes sense. Right.
Yeah.
But I think probably the next thing is going to be is probably increasing the amount of information and the types of information that needs to be released. That's probably in the short term. In the long term, yeah, I mean, it depends on where the technology goes. Again, if we went back 30 years, and we started talking about podcasting, we would both be, shrugging our shoulders going, what's a podcast?
Yeah.
What does that mean? You mean you can talk to each other on a little screen on your phone? Really? Again, going back 30 years. I mean, it was a flip phone, right? I mean, and you had a pager. I mean, it's like, what? So, I mean, so again, depending on where the technology goes, healthcare will absolutely follow it.
Right.
AI is a big thing right now.
Wow.
One
Yeah.
of the big pushes right now, for example, is writing notes.
Hmm.
So again, having a physician saying, okay, I'm going to put in all of the data,
Mhm.
and then you're going to write the note for me,
Oh, wow.
rather than I have to write it myself. And again, it's a huge issue when it comes to physicians, because of course,
Right.
do you really want to be paying your physician to see people, or
Right.
do you want to pay your physician to spend hours and hours writing notes?
Right. Yeah.
Right?
Yeah.
I mean, much better if they can see people. I mean,
Yeah.
that's better for everybody. But those notes still have to get written. So
Yeah.
that's one of the things that they're already
That was
looking at.
something that I came across. My wife Judy, a good friend of yours as well. She was in therapy, and I remember
Wasn't it?
talking to one of the therapists, and I said, "Boy, I noticed you guys spend a lot of time on your computers in the therapy room. A patient will do their therapy, and then the therapist will go off into the corner and they'll be on the computer." I said, that's, you guys got to, she goes, we have to log everything, every contact to the degree. It has to be written in such a way that it appeases the insurance companies, because if you write it wrong, that therapy session could be declined or, not paid for. So they have scripts. They have to follow all the information. It has to be worded a certain way. And I said, boy, you're spending a lot of time. She goes, I spend as much, if not more time on my computer than I do with the patients, because of that very thing you mentioned about being recording stuff. And then I had a pulmonology doctor who I thought he was just not interested in hearing what I had to say, but what he was doing was he was talking into a dictation software that was actually scripting and writing out onto his chart what he was doing with me as a patient. So I'd get the notes and I'd see exactly everything he said, almost word for word. And I said, well, that was clever. He didn't have to write it down. He just talked into the computer and it shows up on the desktop and he's done. Wow. So I want to get a little yeah, go ahead.
Oh yeah, I was going to say again, just to make sure people understand this. I mean, again, we're not to the point, and I don't think we're going to be to the point where, you just say stuff to a computer and it just writes your note for you and you just walk away. I mean, again, the physician will always have to look over the note, make sure this is really what I want to say. I think most people have had that experience when they try voice recognition on their phone, in a text message, and it's like, hey, I didn't even say half of this. So there's still that double check with the human. But again, you think about it again, when it works on your phone, it's a heck of a lot easier just to say it and have your phone type it out than to try and type it out with your thumbs, at least if you are a Gen Xer or older. So one thing I would definitely want to pass on to all of your listeners is if you don't already have access to your healthcare records, you definitely want to make sure that you go ahead and get them. Also, be thinking about your elderly parents, your grandparents, people who might not be, again, as computer savvy, because again, they didn't grow up with this. Just to make sure that they have somebody to help them with that. Pretty much any place that has electronic healthcare records should have some sort of class or some information to go over the particular platform that they use, because it's in the best interest of the provider as well as the consumer to be on this. Again, it helps the provider because, of course, it allows you a number of different ways to communicate with them. They don't have to pick up a phone and call you, all right? I can just send you an electronic message and you get it. As opposed to, I have to call you, I have to wait for you to pick up a phone, I have to make sure you call me back so I know you got it. You could do all this electronically. That saves them a lot of time as well, too. If you want to ask questions, you can do that on these portals rather than, again, needing to go to an office and find somebody and have time to actually speak to them. You can just type in a question, and generally speaking, depending on the type of question it is, as long as it's not something emergent, again, within 24, 48 hours, you can get an answer back. So there's a lot of benefits to this. And again, the other thing as well, because you're actually able to read your records now, they're not handwritten anymore. It also gives you a chance just to look over things and just make sure that people didn't make mistakes.
Right.
I'll do another one in my own history. I had somebody actually put in an allergy for me that was incorrect. And I went to a different provider who was actually able to see my records as well because I'd given them permission. They're like, oh, so you're allergic to this? And I'm like, no, I'm not allergic to this. I'm like, oh. So I was able to then go and trace that back. Again, where had that been written in, some sort of cursive that I couldn't read, I wouldn't know that. So you're able to kind of, follow up on this because, of course, when it's really going to matter is when somebody has only these records to go on because you're in a position where you can't actually speak for yourself.
Oh, right.
Whether you're seriously injured or, so you really want these things to be accurate. If they're reading them, you want them to be absolutely accurate. If you can't speak for yourself, you don't have a family member that can do that for you. So definitely take advantage of it. I mean, if the U.S. Treasury had money with your name on it, you would absolutely be making sure that you got that money. This is exactly the same thing, these entities have information with your name on it.
Right.
You want to make sure you can get your hands on it. So,
right. Well, Jim, it's always a pleasure to talk with you. I'm glad you had the time in your busy schedule to join me. And I think down the line, if I have any topics or questions regarding the medical information industry or just medical in general, I'll be sure to seek you out and we'll get you back on the show to talk about it. Great. Thank you. Take care.
Well, great. Thank you. And for anybody, again, who's listening, if you have any questions, please make sure you reach out to your professional healthcare provider. They should always be able to answer any of these kinds of questions.
Awesome. That's absolutely great advice. Thank you very much. And we'll chat again soon.
All right. Nice talking to you.
Now, there are many ways you can connect with us. We're on Facebook, YouTube, and Instagram. And you can listen to our shows on Apple Podcasts, iHeartRadio, and Spotify. Now, don't forget, subscribe and you won't miss any new upcoming episodes. Thanks for joining me, and we'll see you next time.